Senator Lindsay Williams. These incredible key policymakers are going to discuss some essential items that affect all of us. I know each of us comes here with different roles, responsibilities, but we have one thing in common, which is our students. And let's get started with that. So since we are a little hybrid, Representative Schlossberg, would you mind being our first person for our first question? That question is, in the literature throughout the day and with our most recent student panel, we've heard a lot about the state of youth mental health. What do you perceive as the most important issues, needs, or priorities regarding student mental health?
In a strange way, I think the most important issue is somewhat intangible and not necessarily one we can direct with public impact, with public policy. Because we all know that, I haven't been at this conference today, but obviously what you've been talking about is the rapidly degrading state of youth mental health and the fact that things continue to really get worse for kids and for teenagers in terms of mental health. I have a 6th grader and a 5th grader, and I see it in their classrooms and in the things that they struggle with. The problem is that I think the challenges extend well beyond public policy. Now, I don't want to say that we're helpless to stop, because we're not. But from a societal, from a cultural, and from an educational perspective, there are clearly things that are happening that are increasing pressures on our kids, that are changing the environment that their bodies and brains were built to handle, and that make it much more challenging for them to maintain solid mental health. Now, again, I want to emphasize that doesn't mean that we're helpless. As public policy makers, we have an obligation to make sure that they get the best educations possible, that they have access to world-class health care, that we can address social determinants of health like housing insecurity, food insecurity, things like that, to try to make their lives better. But I think the biggest issue in terms of youth mental health is the thing that we can't directly impact, which is, by and large, what is damaging their mental health and making their lives more challenging.
Thank you for sharing. Senator Williams, is there anything you want to add to that?
I think that we are suffering a challenge in getting more caring adults into the buildings, whether that be school-based mental health counselors, social workers, both in the school building and then outside the school building, making sure that kids have access to those caring adults that can help them. And so I think that's a large challenge that we have to, grapple with, is how do we do that?
So I hear different factors outside, but I also hear getting more people into the schools to support. Cindy, is there anything else you'd like to add there for priorities?
No, I completely agree with what's already been stated. Getting more adult support, people in leadership positions to support those students when they're in need. We're seeing increased students coming to their guidance counselors with anxiety, depression. Of course, all these things existed before COVID, but it's all been exacerbated by COVID. And I think in some way, there's been a push for a long time to destigmatize issues with mental health. And in a way, I feel like that's been really successful because more adults and children are self-identifying or are supporting their peers and helping them or encouraging them to seek assistance. But that's also created an incredible demand. And the supply just isn't there to meet the demand right now.
Absolutely. And I think that's, such a great big takeaway after our presentation with the student panel that we just had from Avita. Our next question, Senator Williams, would you like to start answer this one? So this question is, can you highlight any meaningful policy development or legislation introduced or passed over the past few years to support youth mental health, or promising practices that you would like to see expanded on?
There was one in the past budget cycle that was my bill with Senator Brooks, which provided paid internships to school-based mental health professionals. One of the challenges I heard during the pandemic and recently was that, our school-based mental health professionals have a lot of internship hours that they have to get to be fully certified to be in our schools. And that is all unpaid. And that is a barrier to access when those jobs aren't as well paid as they should be. So if we want to support getting more of those adults in the room, that was a really big step. So that was passed in the budget, and that will be starting next school year, so that school districts can apply for that and be able to pay their internships. One I would like to see is to create ratios for school counselors in our schools. Right now, we have some schools where you have a school counselor for a couple hundred kids and then a school counselor for a couple thousand kids. So I think that's something that I would like to do.
Awesome. Thank you. And thank you for sharing that, because I know that PSCA really pushed that when it got passed, and we were excited to share that. So if anyone in the crowd was not aware of that, some great things to look forward to. Cindy, is there anything? Would you like to add to that question?
Sure. Yeah, we started, we codified trauma-informed education back in 2019, and hopefully you've seen that being implemented in your schools or in your practices. And as Senator Williams mentioned, there was an investment this past budget cycle on internship grants. That was part of a $200 million package. $100 million of that went to mental health grants, and 95 million was for the mental health grants, and 5 million was for the internship grants. So very excited about that, and hopefully we can continue those kinds of investments, because that money can continue to be spent on trauma-informed education, which I've heard from principals, guidance counselors, teachers, that has been effective, but they'd like to see it expanded. I've also heard that a lot of the mental health resources that are out there are, I wouldn't say plentiful, it's probably not the right word, but they're more abundant in urban areas, but rural areas are struggling to get those resources. And some of that comes from there's difficulty to recruit people to come and live and work in rural areas that also may not be able to pay as much. So there's a lot of workforce challenges there. And I think that's where the ratio conversation comes in. From what I've heard, I talked to a friend of mine who's works for I won't say which hospital health system, but is saying that they're trying to hire mental health professionals, but they just can't find people to find the job. So I worry a little bit about mandating things that we don't yet have the supply to fill. And so that's where I think we need to work on to achieve those kinds of goals. We need to work on getting people in that pipeline. How can we get them passionate about being a social worker? Some people have that intrinsically, they want to do it, but what other things can we use to motivate them or encourage them to get into that field or into the mental health field? PASHE, our state system of higher education, has been going through some pretty significant redesigns lately. They most recently have consolidated some schools, and one of the things that they've been looking at as part of that consolidation at Commonwealth University are stackable credentials. And that's not necessarily a new concept. I think there are plenty of other schools that are using similar strategies, but reducing those barriers to allow people who are saying, I can't afford to quit my job and go to school. I can't afford to work for free and get those hours in order to reach the level of practice for my licensure, or whatever the case is. So just providing more flexibility for people to still work, earn a salary, and then be able to eventually, there are a lot of factors that go into that, reach the educational attainment that they need. And also PASHE has been identifying some high demand occupation areas, and social work is one of them. They've recently made a budget request for this coming fiscal year for about $112 million, and that would be direct to student funding or direct to program funding. So we'll see how that plays out in this next budget cycle. There's a lot of things changing up in Harrisburg and a lot of unknown, but I think there's a lot we've been doing and a lot more we can do.
Awesome. Thank you. Representative Schlossberg, would you like to add to that?
So the items that were directly related to school-based mental health funding were already mentioned. I want to take a second to talk first about a broader effort that'll impact kids, which is the additional $100 million that was budgeted for this school year. I've actually been working with Senator Collette, who's Senator Williams' colleague in the Senate, to try to finalize this money. So we budgeted $100 million for adult-based mental health needs. Now, I mentioned that here because I want to make sure and as I was literally just typing in an email not 10 minutes ago, there's not a hard and fast line necessarily between adult and school-based mental health needs, because a huge chunk of what we did with this adult-based plan is workforce related. And it's not as if we're going to say to somebody, well, you will live in this very adult silo. There's obviously going to be extensive overlap between kids and adults. So the work that we're doing there will have a direct impact on kids and on teenagers, that will have a wider ripple effect on mental health. And it will also help to destigmatize the issue. I have to say that in talking with kids and teenagers and watching the way they talk about mental health is so different than the way it was brought up with Senator Williams of my generation. Lindsay, I think we're about the same age, so we probably have very similar cultural experiences talking with kids, and from an era where I think if you mentioned that you were in therapy, you were the crazy person. And I should have mentioned at the beginning, my background in mental health is, to quote an old commercial, not only am I the president, but I'm also a client. Like, I've been very public with my own challenges with depression and anxiety and being suicidal at different points in my life. And I've tried to use my experience to destigmatize the issue. But when I bring it up, when I talk to kids or teenagers, it's remarkable what a shift there is. And that gives me hope for not only how we talk about mental health in that generation, but how we talk about it from a public policy perspective. Because a huge part of the reason that mental health is not adequately funded is because it's never been held to the same standard and in the same regard as physical health. So you change the stigma, you change the money. And that's hugely important, especially for younger generations, because our generation hasn't done a good enough job, and hopefully yours can.
I couldn't agree with Rep. Schlossberg more. It's so different the way kids talk about it and the way they're just aware of it in a different mindset. And I think building on what he said about the whole community mental health is important, not just what's happening in the school. You also have, I'd love to see community schools expanded. Community schools is a coordinator in a school who doesn't have to be a mental health professional, but somebody who can coordinate the resources that already exist in the community. So is there a service that you can connect that student to and get them help if you can't afford to have a person, full-time in that building? Like, is there a person that can coordinate those community services? And that's another way at getting to making sure that we're getting the best bang for our buck, both in our adult services that are outside the building, coordinating with what's happening in the building.
Awesome. Representative Schlossberg, thanks for sharing your personal experience. And I do want to say, us here sitting here, we know how important student voice is. So it's great to hear that all of you recognize that same thing, that you're hearing and seeing the same passion that a lot of us we didn't share when we were going through school, and how much that is impacting policy conversations. So how important student voice is, that's a huge takeaway here. Can
I just add to that very quickly? Because I want to make sure I really drive that point home. As people, one of the common questions we get as legislators is, well, what can I do to help? Here's the truth. Sharing a personal story is impactful. I know people think, oh, you guys are politicians, you're all robots. And, there's some truth in that. We're always going to love getting votes, but politicians are humans. We are, just like anybody else, hardwired to hear stories. And when people tell us stories, it makes an impact. And more importantly, it makes an impact on other normal people who can then influence politicians. There's nothing more impactful than sharing a story, and there's nothing more impactful than sharing your own story. Nobody has to do anything, of course. But if you're comfortable talking about yourself from a mental health perspective, you can really make a difference. I have 100% seen that time and time again. And again, I'm talking about myself for a second. Sorry, politician. I did not think when I started talking about my depression issues, it would be as big of a net positive to my political career. I don't have any of my campaign lit lying around. We've burned it all. But at the top of my campaign lit is a sentence that says, use your own story of mental illness to bring more. I've used it politically. It's become a net asset to my career. The world has changed, and we can all kind of keep changing it.
Absolutely. It's interesting. Side note, I noticed there was an obituary that was recently shared on social media, written by a father of a student who died by suicide recently. And they said, it's not the depression, isn't the pandemic, it's the silence. And that's the pandemic. And so that sharing and the telling the stories, it does make a difference. It just takes one relationship, one person to believe in you to save a life. And so hearing that and knowing that, it's a huge takeaway. So thank you. We are going to do our next question. Cindy, would you like to take this one to start? What are the biggest barriers you perceive in supporting youth mental health in and beyond the walls of schools?
I think we've hit on probably the biggest issue in my mind, which is the availability of the support services. And that comes from what I mean by that is mental health professionals. I think we've kind of spoken quite a bit about that. the long wait times, lack of beds that are available. And I don't know if that's still just a factor of COVID. I don't want to blame everything on COVID, right? We've got to move forward. We've got to adapt, and we've got to make changes, based on the reality that we're living in. And that reality is that there's a much greater demand for mental health needs. So like I said, getting people in the pipeline to become mental health professionals, trying to expand the services that are available. The other thing I've been hearing, and I talk about personal experience, this is one I just experienced myself in the last month, is reimbursement rates for providers, and then also medical insurance coverage. And so when I was actually looking into some counseling services for my family, there was a number of professionals that were suggested to me by the practice. And one of them was a young woman who was in the midst of her training. And because of that, I could not use our family's insurance to cover those sessions. And in a way, I felt bad not picking her, because I would love to help support her in her educational journey. But at the same time, I have a choice to either pay out of pocket or go through my insurance. And I mean, that's no offense, but that's kind of an easy decision for me. So what can we do to not put people in that position where we're not going to put that young woman further behind or make her educational journey even harder? So I'd like to, and I'll be the first to admit, insurance is not my forte. You're talking to the wrong person about that. But I'd like to work with our professional licensure committee as well to look at, are there ways we can reform that educational journey to get that licensure, and also our Health and Human Services Committee, Banking and Insurance Committee, on ways that we could maybe make some changes. I don't know what they are, but I'm hoping that you guys can tell us, because you see it, you're dealing with it. So please let us know what you need so we can see what we can do to help.
You are speaking to the right crowd, because I'm sure every one of us here can relate to trying to connect students to services and being frustrated with the obstacles and the barriers to equitably access care, depending on what kind of insurance they have.
Yeah, and sort of on a side note too, I'd like to add that I think we also need to make sure that enforcement of policies in schools are pretty consistent. I've seen this recently with my husband. I was a teacher actually for 10 years. I taught social studies in a public high school. My husband still teaches there. I have many friends there. You get the idea. My point is that I hear the stories all the time. My husband's also a SAP advisor too. So he works with a number of students in the student assistance program. And one of the things that I hear a lot is that there's just not a consistent enforcement from the administration, and that affects the teachers, affects the students, because I know there's a reluctance to punish a student, for lack of a better word, but you've got to also think about the victims. So somebody who is struggling or being bullied or whatever the situation is, if they don't see the people in leadership positions standing up for them, protecting them and validating them, they're just going to feel further isolated. And they're going to continue to shut down. And that's where you get the school avoidance and everything else. So I feel like there's just got to be a little more consistency there.
Great, thank you. I think we had a question back there. Yes, go ahead.
One of the things I'd like to see happen, one of the biggest barrier that I have is the reimbursement rate for MA and CHIP. So there's a lot of providers who will take it. And so it's leaving private insurance and having a very difficult time finding outside counseling for my students because the pool is so limited. So we have a very difficult time where I'm at with the reimbursement rate for MA and CHIP. And forget CHIP, a lot of places don't even take it. My hospital-based programs do. So anybody that's connected to a hospital-based typically will take the MA, the rest will not.
I appreciate that. I participated in a Berks County IU forum on mental health, and that was a feedback that I heard there as well. The low reimbursement rates were a factor, but I'm glad that you took it a step further in sharing that. Because of that, they're often not even accepting it. So you can't even go to that provider. And so it's making that supply pool even smaller. Thank you.
Jump in on that for a
Sure.
second, 'cause I'd like to perhaps provide some clarity. So I'm not really sure as much about the reimbursement rate as it is about the credentialing process for medical assistants.
Okay.
The credentialing process. So when you look at the credentialing process for a company like Highmark, it's going to be about a 3-month process to credential a licensed individual so that they can start accepting payments from those, that insurance company. For medical assistance, it can be anywhere from 1 to 2 years. That's it. That is probably the biggest barrier. So I can say with full accuracy that medical assistance for outpatient therapy is one of the highest reimbursement rates. But you don't have providers that are willing to go through the credentialing process.
Thank you.
That is very belabored through medical assistance because it's a 2-phase process. You have to get credentialed with the state. And then you have to get credentialed with Perform Care will go faster than the state. And so the logistics around that is what provides like the inequity. So when we look at perhaps a school district of Lancaster, our largest insurance company that's providing, you know, for a lot of our students are medical assistants.
Okay,
So
that's very helpful.
they're not being able to access the same care that perhaps someone who has private insurance can access.
Thank you.
Thank you for sharing that. Adam?
I'm going to shift, but slightly on this topic to school counselors specifically, when we talk about licensing and credentialing and policy enforcement, I think something that we would really benefit from that we do not currently have very well established is that we have people that go through the training process to become school counselors. They get that credential, they go to a school to do that job, and then suddenly now they're sitting in a lunchroom for an hour and a half writing passes because somebody has to do that. They're being told you have to sit in a de-escalation room for 4 hours in case admin has to deal with a problem, even though that doesn't make any sense. And when they say, okay, what are the expectations of me sitting in this room? And it's like, well, I don't know, I'm not going to tell you. And suddenly now they're wasting time not being able to access their students because there really is no good system of enforcement to guarantee students get school counseling services in Pennsylvania. There's nothing. We've become a catch-all.
Yep.
And, you know, we talk about, we substitute teach,
Yep.
we administer tests, we monitor records, and those things are all important parts of being team players. But there is little enforcement or oversight of whether or not students are getting access to tier 1 school counseling, mental health prevention and intervention. And without that, I mean, we're just going to continue to struggle with, well, but we can't get them into these tier 3 providers to get outpatient counseling. Like, okay, that's fine, but like maybe they didn't need that. Maybe if I would have been able to meet with them 3 months ago and address the developmentally normal problem they were dealing with that by that point hadn't evolved into a crisis, then that would have been a more efficient use of time and resources.
And then you wouldn't have 6 girls up there saying,
Yeah.
go to the counselor, the
Right.
one that's in the emotional support classroom doing
Right.
behavior management, you know,
Yeah.
that whole.
Well, and there's such disparity in how administrators choose to use us because we're just a catch-all. And I feel like sometimes we're preaching to the choir. We know that to be the one voice advocating for that all the time.
Right.
And then your administrators kind of, and I'm not trying to badmouth them, they have their own jobs and responsibilities, but a lot of times they're kind of, they don't want to hear you complain about the duties you have to do because if you got to be a team player and everything we do to help the kids. So then they kind of guilt you into being like, okay, I don't want to complain because everything I do can help a kid and I can turn it into a moment, but it's not really what we're trained to do, you know, and then, you know, then after post-pandemic, you know, I'm getting everybody, because I can't service the kids directly because I'm busy doing administrative tasks. They're like, can you make one of those videos and just push it out to us? So now everything I'm doing virtual, which is great. The kids are getting that message and some of that tier 1 preventative information, but I'm not getting to know the kids.
Yeah.
They see me as the celebrity on Zoom and the TV, but I don't have that direct contact with them to build that relationship.
Which we heard was so important.
My job.
So with that, we only have a few minutes left, so I'm going to let Representative answer this one about what barriers. Get to that, because if we have another minute at the end, hopefully we can address some Q&As.
I think in addition to what was already said, there's just one thing that I want to add, which is that you've got real barriers that exist between physical and behavioral health. We chipped away at some of those barriers, especially in terms of confidentiality restrictions. We actually had what I would term overburdensome confidentiality restrictions that went further than HIPAA does in Pennsylvania in terms of sharing information between physical and behavioral health doctors. We revised that. in this past session. It was actually a pretty successful effort, but we've also got to do a better job of giving physical health doctors behavioral health training and making it easier for behavioral health doctors and physical health doctors to practice, to work together out of the same practice so that there's an easy integration. And if there's a need for a referral, it comes from the primary care doctor and they say, and by the way, just go right across the hallway over there. That's something I think we've got to do. And that would be another reduction in the barriers that I think people struggle with in terms of behavioral health.
Thank you. Senator?
I think one of the barriers that we don't talk enough about is the public transportation access that creates barriers for people. So I hear from one of my hospitals in my district that they sometimes have beds available, but they can't take a patient because there's literally no way for them to get back to their home without paying. Like there's barriers there on the public transit, both to get to a bed or to get to like weekly, a weekly therapist appointment. And if it's not a physical appointment, then there might be barriers in terms of access via broadband, or they don't have a smartphone or whatever to access telehealth. So how are we removing those barriers that the services exist, there's availability, but they can't physically access that either in person or virtually?
Thank you. I know we are about to wrap up, so okay. The one last thing that we will do before opening up for any Q&A is any other things that you feel like haven't been discussed that you would like to share. We would love to hear that. So Senator, do you want to start this one?
I can't think of anything off the top of my head. We hit like the highlights of a lot of different topics. There's so much to dig into the weeds on each of these, but I think we hit a lot of highlights of things that we have a lot of work to do that are, they're not black and white issues, and they're not going to be solved with a silver bullet. Like many things we deal with, it is like getting at it from multiple different avenues and thinking a little outside the box. How can we affect this in the school? How can we affect this in the community? And how can we all get this to work together to create an access for everyone?
Yeah, we heard that this morning with our opening keynote about how important systems is when addressing mental health, because it's not just one part that can be fixed to address this huge need. It is a systemic issue that is across communities. So I appreciate that. Andy?
Sure. I just want to say it's been a pleasure to work with Senator Williams on the Education Committee this past session. Student mental health, just mental health in general, is a bipartisan issue. And it's a bicameral issue. I haven't had the chance to work with Representative Schlossberg yet on this, but I'm glad to be with them here today and participate in the conversation. I also wanted to say that I love that the fee for today is supporting a VEDM. One of my very dear friends runs a VEDM at the high school where I used to teach, where my husband works, and it's just incredible. I think they're a really big part of changing or being the reason why we've seen that change and how young people talk about mental health is because of the outreach that VEDM's done. So I just wanted to give kudos to them, and hopefully they can continue to expand what they're doing.
Absolutely. Representative?
I want to add on something that Senator Williams said as she was talking about broadband access and transportation and systems, and that's this. Mental health is not just mental health. We can't view mental health in an isolated silo. We have to look at it as connected to everything else. For example, if you asked me if I would rather be a student of identical race, income, education, etc., and live in an urban area or a rural area in terms of mental health, the answer, bar none, is I'd rather live in an urban area. That's because from a systemic perspective, rural America has less access to broadband, so they can't do telehealth. They have less access to public transportation. They have worse job opportunities, higher rates of addiction, mental illness, and suicide. That's all connected to public policy reasons that don't necessarily even touch on mental health, at least not directly. So as we talk about mental health care, we've got to do a better job of talking about more than just not these like workforce and reimbursement rates and all that, hugely important, but it's about much more than just issues that directly relate to mental health. You've got to have those broader systemic conversations.
Thank you for saying that. We appreciate that. So at this time, I think we have like 1 or 2 minutes. If there's anyone, I know that there was a few of you that were so really eager to share, because this is the group that we'd love to share experiences. And since we have your attention, if that's okay, we'd love to ask some of those. Mike?
I had a quick question for you. I was really happy to hear that your husband worked on a staff team. In our school, We've seen as many SAP referrals this quarter as we've seen in the whole year in the past.
Mhm.
And I'm wondering if your husband has experienced the same thing in the school.
It's hard to answer because I typically hear, obviously he's trying to respect the confidentiality of the students that he works with. Yeah, he typically shares with me about his experiences with his students. He hasn't really described holistically what the school has been seeing, but so he also coaches swimming, and the assistant swim coach is a guidance counselor, also involved in SAP. And she shared just about the overall increase in guidance visits, students seeking assistance for, anxiety, depression, things like that, and SAP referrals. I don't have personally a good sense of those numbers, but I know everything is definitely higher than it was.
I think across the board everywhere.
Yeah.
Mhm. Absolutely. Anyone else have any? Go ahead.
I just wanted to ask if this group works in a private school. I worked in a private school for 17 years, and I first took that job because I was a young counselor, didn't have experience in being the counselor, but I stayed because I got to counsel more, and it was less paperwork and less of the other stuff. I mean, the trade-off is salary, but if you can make that work, and if you want more flexibility and want to do more direct service,
Mhm.
something to think about.
Interesting perspective. Thank you for sharing that. Anyone have anything else to add? We are so thankful for the three of you taking time this afternoon to be with us. Thank you to Milton Hershey for sponsoring this time. This was an incredible opportunity to have three key players at the table, and a takeaway again, student voice or your own experience, sharing that is really important. And I'm sure that all of you would agree that if your constituents reached out, hearing their stories is really beneficial. So we can encourage that here to reach out to your legislators in your area to advocate for this amazing work.
Absolutely.
Thank you all. Have a wonderful afternoon.
Thank
Thank
you.
you.